You've probably heard that the United States has about 8,000 rare diseases, but only a handful get the attention, funding, and research each year. In a new New York Times feature, the headline asks, "Too rare to care?" A new Center for Rare Diseases hopes to change that. The story centers on a nonprofit that is determined to make gene therapy treatments accessible for those tiny patient populations that big pharmaceutical companies consider unprofitable. This center's mission is to turn what is today a bespoke, expensive, one-of-a-kind drug into a routine procedure that can be rolled out more efficiently in clinical settings. The article follows Nina Frost, a mother whose 10-year-old daughter Annabelle inherited a rare neurological disorder diagnosed when Annabelle was only 2 months old. In the U Fund to National Health, that disorder affects fewer than 400 children across the country and has no known cure. Nina's story is emblematic of the millions of families who feel invisible when it comes to research and treatment development. Gene therapy, a promising avenue that repairs defective genes inside cells, has seen remarkable success stories in certain rare muscular dystrophies and inherited vision disorders. Yet, the cost, often several $million for a single patient, and the low patient numbers make it difficult for pharmaceutical companies to justify the upfront investment. The new center aims to bridge that gap by collaborating with academic researchers, clinicians, and patient advocacy groups to streamline the regulatory and logistical hurdles that plague rare disease therapies. The nonprofit strategy involves creating a shared infrastructure, a centralized manufacturing pipeline, standardized protocols for viral vector production, and a coordinated network of hospitals that can receive and administer quidodosum engineered TRN-TO have his tiny twin. This collaborative model has already attracted attention from several child health advocacy coalitions, and the article notes early conversations with the FDA about potential expedited review pathways. Beyond the technical hurdles, the center also focuses on data collection and patient registries. By compiling longitudinal data on rare disease progression and treatment outcomes, the organization hopes to create evidence-based guidelines that can be shared with clinicians worldwide. This push toward systematic data echoes wider discussions in the rare disease community about the need for better clinical trial designs that can accommodate small sample sizes. The article also touches on the ethical dimension. Because rare diseases often involve children, the center plans to implement strict oversight and patient-centered consent processes. Nina and other families are quoted as hoping that a more organized, affordable system will allow their children to access life-changing treatments earlier, rather than waiting for the market to decide which conditions are worth treating. In the slashes of back pages of the New York Times, the editorials examine how the current economic model incentivizes only those treatments that can be sold to a large market. The center's leadership stresses that sustainability will come from economies of scale, making each treatment cost less per patient over time, and from a public-private partnership model. Their vision is to reduce the human burden of rare diseases from an isolate passion to a medically standard care option. In a personal note, the writer recounts leaving the newsroom to sit with Nina and Annabelle as they discuss the future. The piece ends with the image of a small child, tired, hopeful, standing beside her mother, every context in verse. The center's goal is clear: to ensure that no child with a rare disease has to feel too rare to care. Thank you for joining us today on the Pulse of Rare Disease Advocacy. If you want to read the full New York Times article, just click the link below and stay tuned for our next episode where we explore patient stories and scientific breakthroughs in the world of genomics. Until next time, keep listening, keep learning, and keep caring for those who most need it.